Hi everyone, I'm Justin Levine. I'm the Director of Neuro Health here at Telos, and today we're going to be talking about PrTMS. PrTMS is a neuromodulation technique, and what this procedure does is it attempts to fix what we call brain arrhythmia. So brain arrhythmia is when our brain waveform is disrupted or kind of out of line. And through PrTMS, we're able to realign the brain through a training protocol to help with associated mental conditions such as OCD, anxieties, depression, ADHD, and concussive type symptoms. PrTMS stands for Personalized Repetitive Transcranial Magnetic Stimulation. We're able to take an initial QEEG or brain scan, create a specific prescription for you. We've seen over a 50% reduction in anxiety and depressive symptoms in individuals. We've also seen over an 80% reduction in OCD symptoms. One reason to come in for PrTMS is to kind of work towards addressing some of these mental conditions. A second reason could be for generalized performance. If you're an athlete, if you're looking to do better in school, it can help with your focus, it can help with your sleep quality. PrTMS works through the neuromodulation technique by use of Faraday's law of induction. So Faraday's law of induction states that if you have a magnetic field and you send a pulse, in this case a magnetic pulse, then anything in that field, which here it's about a tennis ball size, can receive that signal and it can react towards it if it's a good conductor. Neurons in their nature are great conductors, so when we send a magnetic pulse at a specific frequency to realign the brain, what the brain is able to do is it's really smart, and it takes that signal and then it teaches itself to use that signal and it starts firing at that frequency. For somebody that uses psychiatric medication, for example, what that's actually doing is it's blocking a receptor or it's solving the problem by almost tricking the brain into thinking one thing to then release a certain chemical. However, PrTMS is amazing in that instead of treating symptoms, it actually is treating the source. So by treating the source, PrTMS is a potential option to reduce or even eliminate psychiatric medication use. In the medical world, when you have over a 90% response rate in a technology, that's almost unheard of. And the reason that this treatment is so effective is that personalized aspect, but the second portion is the consistency. So we actually bring in our clients 5 times a week for about a 45-minute session. So in the first 7 weeks of our protocol, our clients will come in that 5 times a week, but for those last 2 weeks, we actually taper off protocol. So we'll do about 3 sessions one week and then 2 for the final week. To make it more affordable, here at Telos, we offer a significant discount, and we accept most major insurances. So in starting treatment, the first thing that clients generally see is improvement in sleep. Then a couple weeks later, they start to see some improvement in their anxiety and depressive symptoms. And after the full protocol, which is about 40 treatments long, the brain is now functioning optimally. However, we haven't provided some sort of a helmet. And because of that, different life events can alter course. If you get a severe concussion, if you're using illicit substances, if you've just completely thrown your sleep schedule out the window and you'd like to have some readjustments to things and realignings, you actually can come back in for about a 2 to 3 week booster session, and that usually gets you running right back up to speed. So what we want to do for you today is go over the treatment process so you don't have any apprehension or hesitation as to what the procedure would look like. So for our treatment protocol, we want it to be as relaxing as possible. So we have nice dim lights. We'll generally play some music in the background.
Are you nice and comfortable, Justin?
I am.
Awesome. Okay, now what I'm going to do is I'm going to punch in his personalized TMS protocol. Once his personalized protocol is set, I will then place the paddle onto the first position of his head.
So the paddle really just feels like it's placed very gently on the top of my scalp. It's not uncomfortable, and it really just feels like somebody has placed their hands on my head.
All right, once the paddle's firmly set, I'll give him a countdown. I'll say 3, 2, 1.
It's a subtle clicking, it's not too loud. If you have music and other things in the room, you barely even notice it. And what it feels like at this kind of setting is honestly just a light touching of my head. It's comfortable. Really, all you have to do is sit here and relax. So after the protocol is done and I've completed my treatment, I'll actually receive a little snack, whether it's a fruit chew or a Gatorade, and it's going to replace the glucose that was used during the treatment. So now that you're interested in PrTMS, here's how the process starts. We'll start with an initial consultation, which will have a QEEG and a neurocognitive assessment package. Myself and the psychiatrist will look at your QEEG and we'll analyze it with you, and we'll determine if we think you're a good candidate for treatment. If you believe that PrTMS could be helpful to you or a loved one, there's a link below to schedule your free consultation.